Hi, everyone. Welcome to our session of Let's Talk About Mental Health. I'm Rebecca Troop. I'm the Vice President of Community Relations at Seacoast Mental Health Center. For those of you who don't know, we are one of New Hampshire's 10 community mental health centers. We have physical locations in Portsmouth and Exeter, New Hampshire. We currently see our clients both via telehealth and in person in our offices. We also see people through our emergency services line, which is open 24/7, 365. And we see people in the emergency department at Exeter Hospital. Additionally, we are co-located within most of the schools in our catchment area, along with some of the Core and Appledore primary care offices. And as a community mental health center, we provide a broad, comprehensive array of mental health and substance use disorder services, regardless of anybody's ability to pay, to children, adolescents, adults, families, and older adults throughout the eastern half of Rockingham County. So I'm joined today here with my colleague who will introduce herself, and she is our expert presenter, and I will pass this over to her.
Well, good evening, everybody. As I introduce myself, I'm going to work on sharing my screen so we can get this set up. And hopefully, I'm going to kind of look for a head nod from Rebecca before she logs out to see if everybody can see. Can you see my screen, Rebecca?
Yeah.
Perfect. All right. So I am Jody Labarsky. I am the Child, Adolescent, and Family Services Director here at Seacoast Mental Health Center. Oops, let's back that up a little bit. There we go. I'm entering my 14th year of employment here at the center, and along with working at the center, I'm a licensed clinical mental health counselor in the state of New Hampshire and a certified youth mental health first aid instructor. And before I begin with our slide deck, I just want to acknowledge that today is World Bipolar Awareness Day. This day actually marks what would have been Vincent van Gogh's birthday, who was posthumously diagnosed with bipolar disorder. And the intent of the day really is to bring awareness to bipolar disorder and reduce the stigma. And as we enter into this, what I'm going to call a mental health 101 conversation tonight, that's really what the intent of this conversation was as well. To give a really quick overview of mental health, how we have more open, direct conversations about it, and how we work as ambassadors to reduce the stigma. So as we get started, I want to share this video. This is a brief video that really talks about what is mental health and the importance of talking about it. Oh, so I apologize. I just realized that the sound isn't working. All right. So these sometimes are those technical difficulties we can't control for. So rather than trying to put my information technology hat on and troubleshoot why possibly this is not working, what I'm going to do is talk about what the video was intending to represent. It's going to bring us into our presentation. So really the video was intended to represent the fact that we should be talking about and really reflecting upon mental health and mental illness no differently than we do about physical health and physical illness. It really goes over the importance of how the more we can have these very natural, normal conversations without the stigma attached, I think it allows us to have that open dialogue and have that comfort with seeking the care that we might need. So when we really thought about this presentation this evening and what we were hoping to share, we really thought about what are those diagnoses that we see most often here at the center. And while we see a full range of mental health diagnoses, probably the two that stand out the most are both depression and anxiety. And if we're reflective of this past year and the experience that everybody has had as we've navigated the pandemic, we have seen how the isolation, the loss, the quick pivots, and the just unknowns that everybody has experienced has really exacerbated the mental health needs of everybody. I think we've all had those days where it has felt difficult. We felt that struggle. And so we wanted to highlight, kind of where is that spectrum of when it's the everyday blues versus moving more into a signs and symptoms of depression where we might be wanting to seek out mental health care. So let's talk about that. The everyday blues, these are those moments that we might experience where we're struggling to manage the daily stressors in our life. Maybe something has occurred at work or within one of our interpersonal relationships, and it just leaves us feeling not quite like ourselves, feeling down. These are the everyday blues. Where we begin to become concerned is when those everyday blues become daily blues. It's lasting several weeks, and we're finding it has an impact on our daily living, and we're not able to complete or fulfill those responsibilities that we have. When we're talking about signs and symptoms of depression, this is just a brief overview of some of the things we might be looking for. These signs and symptoms are represented across the lifespan, and so this might be information for you as somebody tonight who's with us because you're feeling that struggle and you're wanting to gain more understanding into what your needs might be. You might be caring for somebody that you're observing is beginning to struggle and wanting to gain more information how to identify and offer support to them. You might be the parent of a child who you're finding who's struggling. So when we look at signs of depression, we're looking at that unusually sad mood. Again, this is beyond just that daily blue that we might be experiencing. This is that sad, labile, just stuck in the gutter mood that no matter what we do, we can't seem to lift ourselves out of it. We're finding that we're no longer interested in those activities that we once enjoyed. We're pulling away from those activities, pulling away from others, and finding that we just don't have the energy, the motivation, or the stamina to engage in those things that we once enjoyed. We're seeing sleep disturbance, and sleep disturbance can really be represented in a lot of different ways. It might be an increase or a decrease in sleep habits. It might be that struggle to lay down at night and be able to relax and rest our mind so we can go into sleep. And finding that once we are asleep, it's very disturbed and we're waking up frequently and struggling to go back to sleep once in that sleep state. We're starting to feel more worthless, as if we have no value and there's no opportunity to give value to experiences around us. And we're finding it harder to concentrate, focus, whether again it's on our personal life, our work, our academics, whatever it might be that we're needing to attend our concentration to. We're finding ourselves more irritable, easily agitated, quick to anger, and noticing changes in our eating habits. Again, whether that's an increase, a decrease, skipping meals, or just finding as if we're using food to soothe or comfort ourselves because of those feelings of sadness that we're having. All of these symptoms are incredibly concerning, and we want to be aware of them, especially when more and more of them are stacking upon each other. But definitely our red flags need to go up when we ourselves or somebody we are providing care to, that we're associated with, that we work with, begins to express thoughts of harm, suicide, or plan to end their life by suicide. This is when we want to make sure that we're accessing care in such a way to address those acute needs. And finally, if somebody is using substances, whether that be alcohol or drugs, in order to suppress or manage the symptoms that they're experiencing. In talking about anxiety, again, it's very important to talk about what is more typical anxiety, things that we experience as human beings, versus when anxiety becomes atypical and starts to take over or have control over our daily living and our lives. We talk about the fact that anxiety is a really good thing. It's that internal kind of awareness, those bells and alarms we get in order to keep ourselves safe, to make decisions that are within our best interest or in the best interest of others around us. It's that worry, that stress we feel if we have a test coming up, or maybe we're applying for a job and we're hoping that the interview goes well. We're looking to ask our employer for a promotion and wanting to make sure we get that script and that speech just right. That's normal anxiety. It's kind of keeping us on our toes. If I'm driving down the highway in high winds in a big rainstorm, as we experienced this last week, my body and my mind might be sending indicators to me to slow down or to watch how I change lanes. Good anxiety as far as keeping myself and others safe in the vehicle with me. When we start to talk about like when anxiety becomes atypical or maybe gaining more control over our life is using that same example. If I'm driving down that same highway, it's sunny, the sun's not in my eyes, the road is dry, and I'm feeling anxious and nervous as I'm driving, I'm starting to generalize those experiences to situations where I shouldn't be feeling anxiety typically. The anxiety and those feelings become severe, they're longer lasting, so they're persisting longer than within the moment, maybe where I should be sending those alarms or triggers to myself, and it's interfering with my daily living. Maybe I'm avoiding that route to not go over the bridge, which is causing me to be late to work, to appointments, picking a child up from school, and it's becoming more long-term and terrifying, where it's almost leaving me stuck and unable to do those things that I need and want to do. So again, when we think about signs, symptoms that we might want to be looking for, again, within ourselves, if we think that this is typical anxiety that has grown to more atypical anxiety, or if we're observing things that are going on for a loved one, a family member, or a child that we're providing care for, we're looking for those increased kind of physiological symptoms. Oftentimes, individuals who are struggling with anxiety will report having chest pain. They might express thoughts of feeling like they're having a heart attack, as if they can't breathe, that a weight or something is sitting on their chest where they're unable to get breath in and out. They're noticing an increased heart rate that is oftentimes described as racing. They're feeling increased sweating. They're noticing it in situations where they shouldn't be experiencing sweating, or even feeling clammy and cold to the touch. They report feeling dizziness, that shortness of breath, nausea, or some of those other somatic symptoms, which might be headaches, stomach aches. We see this a lot in our younger elementary school age population, who may be making requests to go see the school nurse when they're feeling uncomfortable and anxious in their classroom setting. Those excessive fears are growing, and there's larger reports of more and more fears. And we're finding that the individual is beginning to avoid those situations that promote or create the anxiety, which creates those difficulties again with concentration, focus, the ability to complete tasks. And we're seeing that similar irritability and anger, quick to anger, that we do with folks who might be struggling with depression, and again, sleeping and eating disturbances. We find very often that sometimes anxiety and depression go very hand in hand with each other. So at times the anxiety might create depression for an individual because they're feeling so overwhelmed by those anxious feelings. And so we're, as professionals at times, we're working with individuals to kind of balance, provide support and strategies for both diagnoses at the same time. So we talk about the fact that anxiety affects 1 in 8 young people. This is important because we really want to be aware, especially as we're hearing reports of students returning to more in-person learning. Many students haven't been in a classroom for the past year. And now as they return, this is not only creating anxiety for their family systems, but for the students as well. And so having this awareness of some of the symptoms, some of the things that a young person might be expressing, allows the loved ones around them and the professionals, both in a school setting, administrators at a school, to maybe perhaps provide the care that a young person might need to support them as they navigate their journey back into a classroom. We may see this then in their parents and caregivers. It's going to feel very frightening after this year to kind of return to some sense of renewed normalcy. And so having the awareness of the signs and symptoms are very important. We do find it's the most prevalent of all the mental health diagnoses that we attend to here at the center. And again, about 40 million adults ages 18 or older will have anxiety in a given year. And we're only seeing, these are statistics that were given to us prior to the pandemic. We're only seeing these numbers exacerbated by the pandemic. So when we talk about mental health and what we do to help support or give tools and strategies to somebody who might be struggling, it's really important for us to talk about protective factors. I love thinking about protective factors as just these building blocks, things that we can build upon to help promote the mental wellness of a person maybe who's going through a period of struggle. We're talking about things like healthy lifestyle. We know when we have good overall wellness, this contributes to our overall mental health wellness. So things like proper diet, nutrition, getting adequate sleep. We know engaging in some form of physical activity can be really beneficial because we're producing those natural chemicals and those endorphins that make us feel really well. When one is struggling with mental health, they may oftentimes feel very out of control, especially when they're battling depression or anxiety. It starts to feel as if that diagnosis is taking control rather than that person having control over their own life. So we want to find an opportunity for that person, for the self, to find some sense of control over one's life. For many people, a connectedness to their spiritual community, their faith community, really is one of those protective factors and building blocks that add to their mental and overall wellness. We're looking at things like consistent routines. And gosh, this has been so hard during this past year. We know that people made quick pivots as far as their work environments, being at home, assuming maybe multiple roles during this pandemic, and really not having that opportunity to build in those routines, which also may have included both self-care and decompression time to make that shift from home to work and back to work from home. And so finding this opportunity to build in those routines, we know as adults, this is where we build in our self-care time. We know for children, this is where we create predictability for them. So when we can build those back into our structures, it really helps with our overall mental wellness as well. Finding that ability to problem solve. And sometimes that ability to problem solve might be using your strong support network. Who are those go-to people? And I often talk about the fact it's not about the quantity of your relationships, it's the quality of them. So as long as you have two really trusted people in your life, maybe those are family members, it's a friend, it's a colleague at work, but somebody you know has you no matter what. They're going to scoop you when you're not doing well. They're going to help you problem solve and maybe even remind you of what are the strategies and tools that you can tap into when your mental wellness is not as well as you need and want it to be. Finding those outlets and those opportunities to engage in pro-social activities that, again, once really gave us a lot of joy and pleasure. And if we found ourselves retreating from them, how we can make those conscious efforts to really engage in those activities again. And at the very top of this wheel, I have one trusted adult, because one trusted person, excuse me, the research shows that of all the protective factors that we can have and all those blocks that we're building upon each other, the most important protective factor for each and every one of us is that one trusted person in our life, that one person, again, who can scoop us no matter what, who reads us, who knows what our needs are, who can give us that honest feedback, have that patience when we need it, and give us that support and care that we might need when we are struggling. So when we think just real quickly, what's a quick snapshot of some strategies that we can look at, think about, potentially use? I put on here, find time to decompress. I think given this last year and the experience everybody has went through, it's so important to find those moments of decompression again. For folks who've not been going physically to a work environment, maybe they've been working within their house for the last year, when it's 5 o'clock, rather than grabbing their keys, getting in their car and driving home, they're taking their hand and potentially closing down a device or hitting a button to shut off a device. So finding that moment, even when you're a remote worker, to say, my day has ended and I'm going to go take a walk, or I'm going to go play an online game, or I'm going to go outside and do a little gardening, whatever the case may be, but having that moment to transition from work to home and being able to be present in your home environment. And that same thing, like when you get into your morning routine and it's time for your work day to start, what are some of those structures, routines that you have to build in to say, like, okay, I might still be at home, but here's how I went from my role of being a home person to being an employee and doing my job from my house. So again, building in those transitions, finding ways to feel productive, knowing when we need to seek support, who we seek support from, and being able to ask for it when we need it. Having patience with ourselves and those around us. And I think patience is so important. It's a tough time already. And if we're struggling with anxiety and depression, having patience with ourselves to understand that this is a hurdle we can get over. Be patient with ourselves as we tap into what are those strategies, those tools that we're going to need to utilize, and patience with those around us as they gain to understand why we might be struggling and what we need at this time. Having compassion for others and ourselves, for those individuals around us who may also be struggling, and knowing and setting those limits. Knowing our own personal limits at times when we need to say no, because that's about filling our bucket and taking care of ourselves. And if we're extending care to someone else, when we need to say no and set a limit because it's going to extend us too far where it may compromise our own mental wellness. And recognizing that none of us are superheroes. Even if we wear a cape, we don't have the ability of solving things for others. All we can do is be a support, be somebody who can offer that care, that compassion, and a guide in a situation, but never can we take that away from somebody. All we can do is offer that care and compassion. So if you're in a situation where you are observing that a loved one, a child, somebody you care for, a colleague, a coworker, whatever the case may be, might be struggling. You're thinking about some of those signs and symptoms we went over, and you're recognizing like, geez, I think that this person in my life might be struggling. They've gone from a place of wellness to feeling or looking unwell. And what can I do to help? These are just a few tips of if we're going to offer that phone a friend card to somebody, what we might want to do in that situation. And first and foremost, we really want to make sure we're listening carefully. If we're going to extend care, we need to make sure we have the ability to offer it. And it's got to be free of distraction. So if I'm going to approach a friend and say, I've noticed lately that you don't seem quite like yourself, you seem more sad, I need to make sure I don't have my cell phone next to me, that I'm not trying to clean up email or manage a text message if I've made this genuine, authentic offer to offer care. We want to offer support and make sure that we're offering only what we're capable of doing and having really realistic expectations around that. Don't offer care and support if the expectation is that there's a payout or a reward for you. Do it from a place of being genuine, unconditional, and making sure that you have the ability to do what you're offering to do. If we've engaged somebody and we're listening to them and we're talking to them, making sure that we're not interrupting, that we're not confronting, offering too much advice, because for the person who's opening up, this may be their first time talking about their mental health struggle. It might be their first kind of step toward accessing care for themselves. And so we don't want to stymie or stop that process in any way. We want to be as incredibly as open as possible, being realistic, and most importantly, instilling hope, letting that person know that it's really tough right now, and with the right supports and the right tools, there is hope and opportunity for recovery. And that's what we want to make sure as we're offering that care to somebody we love. So who can help? You know, it's recognizing that none of us ever need to give up. As our signs here say, we're never alone. And each and every one of us as humans really do matter. And there's a variety of supports out there. There is not a one size fits all when it comes to mental health care. It's really unique to the individual and what may work for them. If you have been in treatment before and it was successful, maybe look at what was working with that situation. Why was it successful? And how can you find those same resources and supports again? You know, we have a cohort of medical practitioners who can offer care. For many, they have a really long-term relationship with their primary care physician, maybe with a nurse practitioner or a pediatrician who's been working with their child. So these are individuals that maybe they want to first start that conversation about what mental health care may look like for them. Nowadays, many medical practices have mental health providers embedded in the practice. And so there may be somebody within the practice who can, again, be that first step toward the professional care that the individual may need. Those medical practitioners, along with psychiatrists, have the ability to discuss and potentially explore medication management with individuals to see how medication can be used to manage the symptoms in order to engage in that talk therapy, develop the strategies and tools that one might need to manage their symptoms long term. We have our silo of mental health professionals, which include psychologists, social workers, marriage and family therapists, pastoral counselors, clinical mental health counselors. There's a cohort of individuals here who can provide that mental health care, many of which who are using evidence-based practices that are researched and studied and endorsed for their efficacy. And so these are the individuals who can be doing some of that talk treatment with somebody to, again, address the mental health challenge that the person has encountered, tools, strategies toward taking those steps toward recovery. And then our last silo are peer support specialists who come from a perspective of lived experience. For our younger students and those in higher education, it may be connecting with guidance counselors, social workers on campus or within the school setting to get some mental health care within the school setting, and faith leaders who can offer that care as well. If we kind of go just below the iceberg a little bit and we think about the resources locally that some of our listeners tonight might want to take under consideration for themselves or somebody who might be struggling, across the state of New Hampshire, we are built around 10 community mental health systems. Here at Seacoast Mental Health Center, we serve the eastern half of Rockingham County, and we serve our residents regardless of their ability to pay. As my colleague Rebecca mentioned, our center and the other sister centers have emergency services available 24 hours a day, 7 days a week. You do not have to be a patient of the center to access emergency services care. You just need to be in that region to access care. So I use the example, if my aunt is visiting from Missouri, and while she's here visiting, she experiences a mental health crisis. If she's in my home, which is in our catchment region, she can access our emergency services care to address her acute needs at that time. And within the community mental health system, there's a full array of services. Again, not a one size fits all. That treatment is really specialized for the unique needs of the patient who's entering care here. We're also very fortunate within our region and state to have a robust community of private therapists and group practices that individuals can choose to utilize for their mental health care. I've went over emergency services already. We've talked a little bit already about primary care physicians, pediatricians. Again, they may have really good ideas and insight as to what your mental health needs are and who might be a really good practitioner to take care of that, in addition to potentially having somebody embedded in your practice where you receive your care. We talked about school guidance and social workers and really the importance of their roles as our children return back to in-person learning within the next few weeks. Faith leaders and spiritual communities. Many businesses and industries now have contracts with employee assistance programs. This is an opportunity for an employee and sometimes their extended family members to access mental health care through their work for a more brief focused treatment. So sometimes it's anywhere between 3 and 5 sessions. That might be enough for an individual to address their need that has presented. And if it's not, the employee assistance program will work to bridge the person over to the next level of professional care that they might want to continue engaging in. I put the National Suicide Hotline here. This is a hotline that's available across our country. Within each state, there's a hub that these calls go into. And so the responders to those calls will do a telephonic assessment interview. And if they find that the needs of the caller go above and beyond just the crisis support that's offered, they will bridge and connect that person to another level of care. In our region, it might be bridging them and connecting them to emergency services through the center. And then finally, we have the National Alliance for Mental Illness. We have our state chapter. NAMI does an amazing job of offering resources, tools, information on their website as far as prevention tools and resources that both professionals and individuals seeking care can utilize on their journey toward mental wellness. So since I've had some IT hiccups with videos, I'm not going to attempt to share my video. I'll give it one shot. We'll see what happens here. But what I
you know that feeling where your thoughts scare you? That makes sense.
All right. So thankfully, Rebecca unfortunately has let me know that the audio is not working again. So I apologize for that. What I will mention here is this video was used as kind of our closing piece tonight because I can't stress the importance of how important it is for us to be talking about mental health, to be having these conversations as an opportunity to be reducing the stigma. No individual should ever avoid getting their mental health needs. They shouldn't avoid seeking treatment and getting their needs met because of the worry of the stigma that has in the past been attached to mental health treatment. I continue to view mental health treatment no different than any other physical health treatment, and really work to aspire to a time where we can treat them both similar and have society view them both that way. And so I always hope that there's an opportunity for anybody who's participating in our presentations or discussions that we all walk away with the mission of being ambassadors for talking proactively about mental health, taking opportunities to engage in prevention activities, and really supporting those around us who need to engage in treatment needs as their needs increase when it comes to their own mental health and mental wellness. And so with that said,
We learned that we didn't have to be.
with that said, we are at the point in our presentation where I'm going to stop sharing and we're going to open it up for a few minutes for questions. Rebecca has this amazing sunlight that is coming into her window right now.
Sorry.
You'll serve well as a moderator with this beautiful glow behind you.
Oh, that was a little nuts. Jody, thank you. That was fantastic. You know, I know a lot of questions that I get from people all the time is, you know, I'm observing this or I'm feeling this. It's the what do I do?
Right.
Or I see this and is it a problem? So it was really great. I've had a few requests from people. If the slides will be available.
Sure. I can.
So I will be sending out the video to people.
Yes.
So we can.
Yeah. So I was going to say, I can get those put in the read only mode and I will send those to Rebecca and she should have a list of our participants, excuse me, and can send those out to folks who might need it.
Yeah.
Perfect.
I will. So, you know, we thought we'd take 10 minutes or so for questions, and I do have some. So one of them, I think we can start with these, is somebody had asked, what should I do if I'm not sure if my mom is depressed? I don't live with her, so I'm not really sure, but she just doesn't seem herself.
Right. Well, it's a really, I think, great question and difficult too when we might not be in close proximity to someone. And it becomes even more tricky because unless you're your mom's legal guardian, you don't really have that ability to access her providers or maybe talk about it. So, you know, I would think a couple things. Like when I think about it from the context of like myself, I feel like I know myself best. And it can be hard to really reflect, like if I notice something's different about me, but I think we all have that innate ability to say like, I'm feeling a little off, things aren't right. As parents, we're the best kind of moderator to kind of determine when things are challenging for our children. And then when we start to look at family members and loved ones around us, again, we know and see things when they might be occurring. I think if you have a relationship with your mom where you can have a very honest conversation, I always role play with people. So if they know me well enough, they know I do it. So if Rebecca's my person, if I'm saying like, you know, Mom, I'm noticing you just don't quite seem yourself lately. And this has been a really hard year from everyone. Seem a little bit more down. I don't see you getting as excited about things that you used to. Have you been feeling more sad lately? It's, you know, depending on the nature of your relationship, maybe having that honest conversation, maybe using tonight's presentation as your kind of entry point for conversation. Like, I went to this presentation the other night and they were talking about anxiety and depression. You know what, Mom, I started noticing like, gosh, this pandemic has left me feeling really anxious. And then I got thinking about everybody around me and I noticed like, you're just a little bit more down lately. Can we talk about that? And so maybe finding just what is that comfortable, easy entry point that you can use. If your mom has a partner or she's, you know, in a relationship with somebody, maybe talk to that person, siblings, if they're noticing the same thing. But how can you use the supports around your mom maybe to address it?
Okay, great. So somebody else, which is somewhat similar and maybe could be another entry point in thinking about this, if you have to approach somebody, was if you had to, and we'll challenge you on this one, what would you say, would you name as the number one important thing to keep you mentally healthy?
The number one thing to keep us mentally healthy is our focus on ourselves. I'm going to use that very like age-old adage that many of us in mental health have used and we've heard, and that is, when that oxygen mask falls, if I don't put it on myself first, I can't help anybody around me. So I think the most important thing for all of us in order to maintain our mental wellness is we have to take care of ourselves first before we ever have the energy and the ability to take care of anybody else around us.
Yeah, that's it. That over last year when, you know, with everybody in the same house And when I'm realizing I'm getting super short with everybody, it's because if I really looked at myself, it's because I hadn't gone in first.
Right. And again, like you just expressed, I think, that kind of moment that many of us have had and continue to have, because everything is just diffused and mushed together. And it's recognizing, like, when we all flip our devices down at the end of the day, being able to say to your family and having them be okay with it, like, I just need some me time right now. I'm going to go take a walk by myself to decompress. And when I come back, then why don't we all go take a walk together, or we all make dinner together? You know, you find that ability to reconnect while still focusing on the self and taking care of oneself.
Thank you. So somebody here had asked, I'm trying to decipher through the question, is basically how you talked a lot about kids and going back in school and keeping our eye on our children. And this individual says that she's tried a lot of places to help get her child some care, and she's having a struggle finding a place. What should she keep doing, and what should she do in the meantime?
Right. You know, and this is one of those places where we've realized that the plug is not holding the dam anymore. This last year really has brought to surface how a change in our lives can cause such a dramatic, reaction. As adults, we have the ability maybe to kind of manage this a little bit better. And I don't mean perfectly by any means, but we've had some life experiences that have allowed us to maybe tap in again to some skills, some strategies that we've been able to manage it. We've had some rough days, we've had some good days, but for our children, this might be the first major life event that they've experienced, and it's been prolonged. So I say that the plug is no longer holding the dam, because we see it everywhere and we hear the reports that the mental health within our state can't meet the needs and capacity. A lot of folks will talk about calling this provider, that provider, and people are full or just can't get in. So, you mentioned that it's a child. So my recommendations would be is talk to a pediatrician. Again, your pediatrician is somebody that you may have a really good relationship with when it comes to your child's health. And so they may know as well as you kind of what changes your child's experiencing. They, again, may have somebody embedded in the practice that can be providing some care. Talk to your daughter's school. There should be at least a guidance counselor, if not in addition to that, a social worker. And maybe saying to the school guidance counselor, the social worker, the teacher, this is what I've been noticing, what's been going on. I want to make you aware of it. And can somebody be doing some check-in and support with her? As Rebecca mentioned, we at the center and many of the centers across the state have relationships with schools where we have staff co-located. So that might be another way to access care if there's a mental health provider co-located at the school. And then again, work with your insurance company, keep calling, keep leaving messages, using, the resources within the community to get the supports.
Great. Thanks, Jody. Here's one. Clearly someone who knows a little bit about us and our variety of mix and depths of services. And she's asking about what case management is. She's heard of case management before, and she says she has a family member with diseases that are complex, both mental and medical diagnoses, and she's very overwhelmed by paperwork. And is that something that a center like us, any of the community mental health centers, can help with and assist family members or the individual themselves?
Yes, like that's case management, the hammer on the nail right there. Really, here at Seacoast, when we're providing case management to the patients that we serve, it's the services and supports outside of mental health care. So I always describe it as things like, start with your really essential basic needs: food, clothing, shelter, utilities. We sometimes work with individuals who are income sensitive, where it's harder to meet those needs. And so our case managers are looking for resources to address that. But that healthcare, the physical healthcare piece that was outlined in that question, that is absolutely a role of our case managers to help out with appointments, paperwork, organizing and coordinating with other practitioners outside of mental health care. So I always think of case management as all of the needs that make a person well outside of their mental health. Because if you can't meet your food security needs, if you can't maintain stable and safe housing, you can't even begin to focus on your mental wellness. So that's what case management is intended to do, to take care of those other things so you can put your mental health first.
That's one of the things that when I started working here, I thought was so amazing, because I started describing it to people that, we sort of stabilize someone's whole life Because if they, like you said, if they walk through the door and they need to sit with one of their counselors or one of their therapists, but they have this huge worry about their family. If I had to feed my family, I wouldn't be focusing on here, and my oxygen mask would fall off.
Exactly, absolutely. So anything we can do to make sure that those things are attended to so that mental health piece can be taken care of, that's essentially the bridge that case management is intended to build for the individual.
Well, and I think we have one more question that I think is really important. I know we're kind of hitting the time we said we would do for questions, but I really think this is important for us to address, and I appreciate someone asking it. The question is, how do I know if somebody is joking about suicide or serious about harming themselves?
So I'm going to default to my role as a youth mental health first aid instructor, but this is right in the wheelhouse of my role as a clinician as well. We take all statements of suicide seriously. So I feel like, as you know, I'm thinking that this question is coming from a friend, a family member, a loved one, not your job in any way to have to figure out, is this a joke? Is this not a joke? Take it seriously, and that's what emergency services is there for. So if you're the individual who has concern for someone, use our emergency services line. You can access our emergency services by calling our main number, which is 431-6703. During business hours, our front desk staff will connect you to the available clinician. After business hours, calls go to an answering service. The answering service pages our clinician and they call you back. I always say roughly within like 10 to 20 minutes, because if they're already in the middle of a consultation, they've got to find a good breaking point before they return that call. But they are available to run those scenarios past. So I can call, speak to one of our clinicians and say, I'm concerned about my daughter, son, husband, wife, aunt, uncle, sister, whoever the person is in your life, they made this statement and I'm not sure what to do. And you can run the scenario past. They may say like, you know, it sounds like maybe it'd be a good idea for one of us to talk to them. Are they available? Can you put them on the phone? And then now you've turned that over to the person who can do that thorough assessment rather than kind of weighing like, was this a joke or was this something that I should take seriously? But we always take all statements of suicide seriously and really help bridge the person to the care that they might need.
All right. Yeah. Thank you. You know, so many people think that emergency services is just for whomever calls, who needs care, as opposed to I need some guidance.
Absolutely.
I need some help. So,
Yeah.
well, Jody, I really appreciate, we all appreciate the time. I want to thank the people who attended for taking that moment out of your own day and your own lives to learn some more, to take care of yourself, because learning this information is taking care of yourself. It's sort of part of our whole self-care focus.
Absolutely.
You know, self-care isn't just getting a massage or meditating or, you know, doing some physical activity. It's learning things that can empower you to help and keep you well and keep your loved ones well also.
I agree.
You know, and I just want to reiterate what Jody said about our emergency services line. We are available 24/7, 365, and either of our two numbers, the first being 603-431-6703 or 603-772-2710. Both of them, someone is there for you. You are not alone. Your family members and your loved ones are not alone, and we will get back to you. We also have information that maybe can empower and teach you more on both our website and our social media channels. At any time, if you have questions, I'll be following up with, like Jody said, the slides and this video, and we're available to answer questions as need be. So thank you. We hope you all stay well and have a really pleasant evening.
Thank you, everyone. Good night.
Bye.